A nosebleed, also known as epistaxis, occurs when the blood vessels in the nasal lining break and bleed. It is a common condition and can happen to anyone, but it is especially frequent in children, the elderly, and people living in dry or cold climates. Most nosebleeds are minor and can be easily managed at home, though severe cases may require medical attention. Types of nosebleeds: anterior nosebleed. The most common type, where the bleeding originates from the front of the nose, typically from the nasal septum, the wall between the nostrils. The blood vessels here are fragile and prone to break. This type is usually not serious and is easier to control. Posterior nosebleed. This type is less common and occurs deeper in the back of the nose, often involving larger blood vessels. It can result in heavy bleeding, with blood potentially flowing down the throat, and may require medical treatment. Common causes of nosebleeds: dry air. Dry or cold climates can dry out the nasal membranes, leading to cracking and bleeding. Indoor heating can also contribute to drying out the nasal passages. Nose picking or blowing. Repeated picking or forceful blowing of the nose can irritate the blood vessels and cause them to rupture. Injury or trauma. The blow to the nose, such as during sports or an accidental bump, can cause bleeding. Allergies or infections. Allergic rhinitis, sinus infections, or colds can lead to inflammation and irritation inside the nose, making it more prone to bleeding. Medications. Blood thinning medications, e.g., aspirin, anticoagulants or nasal sprays, especially if overused, can contribute to nosebleeds. Underlying health conditions. Conditions like high blood pressure, blood clotting disorders, or certain cancers can increase the risk of frequent or severe nosebleeds. Environmental irritants. Exposure to smoke, strong fumes, or chemicals can irritate the nasal passages and lead to nosebleeds. First aid for a nosebleed. To stop a nosebleed, follow these steps. Stay calm. Try to remain relaxed, as anxiety can raise blood pressure and worsen the bleeding. Sit up and lean forward. Sitting up prevents blood from flowing back into the throat, which can cause coughing or choking. Leaning forward helps the blood drain out of the nose. Pinch the nose. Using your thumb and index finger, pinch the soft part of your nose just below the bony bridge and hold it for 10 to 15 minutes. Breathe through your mouth. Apply an ice pack, if available. Applying a cold compress or ice pack to the bridge of the nose can help constrict blood vessels and slow the bleeding. Avoid certain actions after bleeding stops. Do not blow your nose, bend over, or lift heavy objects for several hours, as these actions can restart the bleeding. When to seek medical attention. Most nosebleeds are harmless, but medical attention is necessary if the bleeding lasts longer than 20 to 30 minutes, even after applying pressure. The nosebleed occurs after an injury such as a blow to the head or face. You experience frequent or recurrent nosebleeds. The bleeding is heavy, or you are losing a significant amount of blood. You have underlying conditions like high blood pressure or a blood clotting disorder, or you are on blood thinners. The nosebleed is accompanied by symptoms like dizziness, weakness, or difficulty breathing. Prevention of nosebleeds. Keep the nasal passages moist. Use a saline nasal spray or apply a thin layer of petroleum jelly or a nasal ointment inside the nostrils to prevent drying. Consider using a humidifier, especially in dry climates or during winter, to add moisture to the air. Avoid picking or blowing the nose aggressively. When blowing the nose, do it gently. Manage allergies or infections. Use antihistamines or other treatments for allergies to reduce nasal irritation. Consult a doctor for proper management of sinus infections or colds. Stay hydrated. Drinking plenty of water helps keep the nasal lining moist. Avoid irritants. Stay away from smoke, chemicals, or strong fumes that can dry out or irritate the nasal lining. Conclusion: nosebleeds are usually not serious and can be treated effectively at home. However, knowing when to seek medical help and taking preventive steps can help reduce the frequency and severity of nosebleeds. Maintaining moist nasal passages and avoiding irritants are key factors in preventing future episodes.